If you're stuck at home today, maybe you've been stuck at home for a long time, I've come up onto a hill with some cows and a lovely view and this little lady. Say hello, Molly. Say hello. Just thought I'd try and bring that to you. It's really peaceful up here. It's really peaceful up here, but my anxiety doesn't care how peaceful or beautiful it is. I feel really, really anxious. The mind is just going over and over on things, social things and so on. And I just, Marley. Marley, come here. Oh. Come on. Let's not have a cow running at us, shall we? Okay, so. Yes, anxiety. I've built a bit of a bridge between the anxious me and the me who's healthy and isn't bothered by all this stuff. Built a bit of a bridge with the help of my counsellor, and it's a bit like the anxious mind, the anxious muddled mind. It fixates on anything really. It doesn't matter if you're in a really beautiful setting like this, and my life isn't that troubled. I've got some social problems, but I'm sort of alright for money, sort of alright for work. I'm not in dire straits, but my anxiety is here telling me that I am. It's fixating on old relationships that have gone a bit wrong and current problems with relationships, and it bears no reality, it bears no resemblance to reality. And as I say, I've built a bridge to the normal me, and I think, what would the normal me do right here, right now, right in this setting? What would he do, and how would he feel? He would feel really peaceful. He'd be absorbing all of this, and he'd feel quite contemplative. He'd be having a load of fun with his dog and the cows, and I can really sometimes really stay with that bridge and realise that this is the inner experience of mental illness. I've been mentally ill for all these years, and the inner experience of it is that it creates all these spurious thoughts and emotions, like completely spurious. I mean, they're not completely spurious. What they actually are is slight niggles that you may have in real life, but you'd probably shake off within a few seconds. They are those multiplied by 50. It's like, it's like chronic anxiety just multiplies any slight niggle, and it probably just creates its own as well. It just seems to want things to feel anxious about. So there's a little chance of getting to objectivity about that. Do you know what I mean? Like, a lot of the time I'm just wrapped up in what my brain's doing, and then occasionally I can come back to objectivity and just say, this is the subjective inner experience of a set of symptoms, namely mental illness, chronic anxiety, caused by a body-based problem. Oh, my dog's smelling shit. What are you doing, Molly? What are you doing? And just that insight that what your brain's doing is a set of symptoms can be quite powerful. It gives you at least the chance. A lot of the time it may not work, but it at least gives you the chance to get back to objectivity and to just get back to a plan, to just think, okay, I'm in a whirlwind of negative emotion right now, but what do I need to do today to push forward with my body getting better. I honestly think all these years of illness, if I could have like a montage, you know, like 30 seconds every day, I'd find myself in a state of like escape on the computer, mostly, almost all on the computer or on the phone. I've spent so much time over these years in a state of escape in screens, and it's sort of what the mental illness does, but it's also a survival mechanism to escape the inner, you know, emotional pain. But yeah, I feel like the fungal infection, I feel like the bugs inside me to control my behaviour. I actually find it very hard to be ultra disciplined with sleep and screens, and I find it hard to be disciplined at all, yeah, with sleep and screens, sometimes with diet. A lot of the time I just feel out of control, and all I can do is escape into a screen or something like that. So in general, it's very difficult living inside a head that's going wrong emotionally so often. That's very difficult. I do feel quite proud of how I'm able to get back to objectivity about it sometimes, and to just realise there is a set of symptoms at work, and there's a whole other discussion to be had about, you know, I know that my mental illness is coming from my body. I have a terrible fungal infection sitting in my chest, which is either poisoning my blood, which is affecting my brain, or sitting on the vagus nerve, which is affecting the brain, or via probably both those mechanisms and others. It's creating a situation where my cognition doesn't work very well, and I have a propensity to anxiety and lowness, you know, and I know it's body-based, absolutely sure it's body-based, because there are times when I get some progress on the body and I get myself back. All of that clears like clouds, and I see a beautiful blue sky inside myself, subjectively speaking. So I know it's body-based, but there's lots of people out there who can't get their head around that, especially people who are counsellors or who've been exposed to a lot of counselling info. If you're suffering with anxiety and depression, there has to be a childhood issue involved in it, or there has to be trauma. And I'm not saying, in a lot of cases I'm sure that's true, but in my case it's all body-based, and that's become a cause of mine, because so many people can't get their head around that and will misunderstand you over it. And when you protest and say, no, this is my body, this anxiety is not from my childhood, it won't help by being processed and talked about, it's just spurious shite coming from my chemistry, please stop trying to tell me it's something else. Yeah, so that's enough for now. See you tomorrow.